The risk is that you're essentially putting your child in harm's way. You are giving them the thing that we know that they're allergic to. Now, we start at very, very small doses, and that gradually increases. And when we increase the dose, it's very important that's done under medical supervision, because that's the bit where they're most likely to have reactions. But in between those increases in doses, as you know, you have to keep giving the dose at home. So every day we're asking, it's a pretty big ask, is we're asking you to give your child peanut if they're allergic to peanuts. Now, yes, it's in small enough quantities that they've already demonstrated they're okay with, but whilst the dose might be the same every day, the child isn't the same every day, because there's days when they've got a runny nose, or they're under the weather, or they've had a late night, or any number of other things that will mean that actually they're more sensitive to the allergen than they were, which means there is a risk they can have a reaction. And if they have a reaction, sometimes those reactions can be significant. And certainly in older children, particularly when they're being desensitized, an important minority can have really nasty reactions. And so that adds, firstly, a degree of anxiety. It means, yes, there's a whole range of rules and things that we try and put in place to try and mitigate that risk, but that risk is there. And you've got to be able to deal with that. Now, you're the one that's taken this home and been through it. I've never had to do that.
Right.
I just have to wait for the emails and the calls in case there's a problem.
Yeah.
But how did that feel?
Right at the beginning, it was pretty nerve-wracking. Because you have this food that you absolutely religiously avoid, which we had done with Isla, and suddenly it's in the house and we're dealing with it, and I'm preparing it and I'm giving it to my child. And like you were saying, it's that constant assessment of how she is that day, and is it the right time? And the golden rules that we get given are really, really helpful. I think that's very supportive. There's a big, a sort of information pack, and you have a flow chart to follow. And so you can start again to have a bit of agency and get a bit more in touch with your instincts. I'd say that's a positive thing about it, is that